Well, this was a big moment for one of the biggest hospitals in Metro Detroit. Henry Ford Health System says it's changing its name and its focus after learning some valuable lessons from COVID. Paula Tutman joins us live this afternoon from what's not Henry Ford Health to talk about the reasons behind the change. Paula.
Hey, Karen. Hi, everybody. Yeah, you know what? It does seem like it's a name change. But when you really take a look at what's in front of it or what preceded it, then you really understand why it had to happen. Despite a battering win just before 10 this morning, the new banner dropped, and just like that, Henry Ford Health System became Henry Ford Health.
Henry Ford saw its first patient on March 14th. On April 7th, we were at our high, which was about 900 patients across our system. And so in about 3 weeks, we went from 0 to 900.
Gone is the formal script writing and the blue oval to a more approachable logo, dropping the word system from the group of 5 hospitals and numerous health facilities.
And it's not just about just drop one name and just make it a little bit simpler. It really is about how do we connect.
Wright Lassiter III, the CEO of the new Henry Ford Health, reins in the still not dealt with feelings of those early days that informed the decision to lean forward and find more connected ways to deliver a different level of care.
I think about the amazing dynamism of our nursing staff, who, when we would not allow visitors, became the surrogate family members of dying patients.
There's a change in your face when you say certain things. Have you processed the emotion?
That's a great question. I think the short answer probably is no. And so it's our hope that this will be one of multiple things that individuals will need to help begin restoring themselves from what has been a 2+ year period of drama.
The mobile integrated health unit sends a team of paramedics with advanced care into homes to keep patients out of emergency rooms.
We alive.
And then there is Darius Flowers.
Ain't no need to worry what the night is gonna bring.
The patient transporter.
I was actually singing just to uplifting my spirits. And one day I remember looking at a patient and they were in tears.
He's encouraged to sing and sing louder when his own brand of care helped with some of the patient healing.
And he started singing and it just blessed my soul.
What does that do to you as a patient?
That makes me feel like, it makes me feel at home, and I'm not at home. And most people hate being in the hospital.
In the morning, rain up.
Yeah, you know, those are just some of the things that make the hospital more user-friendly. Karen, I want to really encourage everyone to go to clickondetroit.com to watch the full uncut interview with Wright Lassiter. He really shares some interesting scuttle about those early days, including how he had to go to what he calls the gray market, not the black market, but something pretty close just to score supplies to get them through. That's on clickondetroit.com, but it really does explain why this name kind of came along with everything that they went through with COVID instead of because.
Always interesting to learn the backstory, for sure. Thank you, Paula.